Welcome to another episode Inside the Loop. As you know, pain management physicians take care of various types of patients. We can manage patients who have had injuries after surgery, patients who have gotten injured after a sporting accident, or patients who have had, due to the life changes, getting old, developed a lot of pain in different parts of their body. And then there's this other type of patients that we very commonly see in our practice are people who have gotten injured at work or people who have gotten injured due to an accident. An accident, whether there is a slip and fall or an accident which occurred due to motor vehicle collision. So the theme of today's podcast is after the injury. What happens after the injury? Specifically, what happens after personal injury? Here today with me is a good friend of mine and an attorney, Mr. Mohammad Owaynat, who is going to be grilled today about some of the things that he encounters in his practice. So without further ado, allow me to introduce you, star attorney Mohammad Owaynat.
You're too kind. Thank you very much, doctor. It's an honor to be here. Thank you for having me.
Very good. Tell us a little bit about your practice.
So we've been doing personal injury for about 10 years. We are located in Downers Grove, but we serve the entire Illinois area, and we focus primarily on personal injury litigation.
What is exactly personal injury litigation?
Personal injury litigation is when someone does something that they shouldn't have been doing, and as a result, someone else suffered the consequences. For example, this happens every day. Texting and driving. A car crash happens, right? Or there's a spill in aisle 4 and no one cleaned it up. And someone walks by and they slip. Someone had a duty to make safe an area or operate their vehicle in a safe and reasonable manner. And they failed to do that. And that's called negligence. A lot of people say, oh, it's just an accident. But no, it rises above that level of an accident. It's called negligence in the legal world. And that's where you need a lawyer to fight for your rights. And when I say fight, there's a reason I say fight, because insurance companies do not want to pay people for their injuries.
So that is a very noble job, obviously, and a very noble profession. Can you give us an example about a typical person that would seek your services?
Well, the most common thing that I see day to day are car crashes.
Okay.
Maybe that's just because there's so many cars on the road. Maybe because Illinois people don't know how to drive. I don't know, but you see a lot of car crashes. Another type of injury that we get a lot is medical malpractice. We also get dog bites. Slip and falls are pretty common. We take product liability. But every day you're going to typically see car crashes.
Okay. So from a legal standpoint, whenever the patient, or rather at that point it's not really called a patient, it's called a client. When a client comes to you, do they, what exactly are they supposed to expect?
Well, when they come to me, they usually have a situation where, like I said, they're injured, they need help. They don't know what their rights are. So what they can expect is clear next steps of what to do and what not to do. Here is the situation. I take the facts of the case and I develop the best strategy to, one, make sure that they get the treatment that they need, and then two, to secure the settlement that they deserve. In personal injury, it's in the word, you're injured. An injured person needs a doctor. They need treatment. So that's pretty much my focus, is to make sure that we take care of the person first. And
so when a person comes and sees you, do they see you almost immediately after the accident, or do they come and wait some time, several weeks after the accident?
Ideally, immediately. Just like a patient,
Sure.
If they're sick, you ideally want to treat them right away so that you can have a higher chance of success, right?
Sure.
You don't want an infection to fester. It's the same thing with personal injury. If you wait too long, you're going to be creating avenues for the insurance company to attack and to start pointing blame. So typically, we want to hear from an injured person the same day, the same hour. I give my cell phone out. So I tell people,
Sure.
call me right away. Call me before you call the police, or call me while you're waiting in your car for the police to arrive.
So, how important it is for a person at the time of the accident, no matter how small or how big it is, to actually go to their own primary care physician or to the emergency room? Do you recommend that people wait, or do you recommend that people immediately after the accident occurs go and seek medical attention?
It's critical that they seek medical attention immediately,
Okay.
not just for their case, but for their health.
Of course.
You want to make sure that you're okay. A lot of times people have a lot of anxiety or a lot of adrenaline, so they don't feel the pain. And, you know, doctor, you can tell me better than I can tell you, there's something called delayed onset muscle syndrome, right? Where people do not feel the pain. So for that reason, they really need to go to the hospital. I recommend, if you're feeling pain, you were involved in a strong crash, take the ambulance, go to the hospital, get checked out, take care of yourself, and then make sure that, you know, you call a competent personal injury lawyer who does personal injury. Not all lawyers are equal, just like not all doctors are equal.
Sure. And obviously, you know, as an attorney, you cannot recommend or tell patient where to go. And to your point, I think that going and seeking medical attention from the person who was injured almost immediately will inevitably put somebody into the medical system. And most medical doctors, I would say all medical doctors, operate on collaborative approach. So when someone goes to the hospital, obviously there's a downstream effect of a person getting an X-ray, person getting a referral to whatever is the ailment at hand, including people who are coming, for example, with purely pain-related issues that are coming to see me.
Mm-hmm.
But I agree with you. I think that the quickness with which a person seeks medical attention, no matter how small or big, is very important. And you mentioned something that is critical. You know, a lot of patients who actually come and seek my attention after any kind of accident, you know, right now we're talking about an accident which occurred after a motor vehicle accident, but even after an athletic injury, seeking medical attention right away prevents the onset of sequelae which occur after an injury.
Mm-hmm.
You mentioned delayed onset of muscle soreness, which is very typical in a person who has had what's called a whiplash injury, for example. If somebody is sitting in a car, if somebody is a restrained driver, or even a passenger who is restrained, if they were hit from no matter which direction, their head and their entire body would get perturbed either forward or backwards. And that quick jolty movement may not seem like a lot to a person because of all the other things, the excitement and nervousness and everything else that happens around them. But several days after the accident, patients do actually experience a significant amount of pain, which eventually, hopefully, as long as, you know, all the other things have been checked out, resolves. So the point is that I absolutely agree with the way that you framed this.
Thank you, doctor. And I want to ask you a question.
Sure.
Doctor, in your experience, does it really take much for a person to be injured in a car crash? Like, do they need to be severely hit at 50 miles an hour, or could they be injured from getting rear-ended at 5 miles an hour? Does it matter if there's a lot of property damage on the car? Or what if someone was hit at 5 miles an hour and their neck suddenly snapped back and forwards, but there's no damage to the car? Does that mean that they're not injured?
Well, no, not at all. You bring up a very good point. The culprit of all of this is that we all experience perception of pain in a different way. Pain is perceived by one person as enormous for the same type of an injury, and for somebody else as minimal. Pain as one of the primary reasons for people seeking medical attention varies between different ethnicities.
Mm-hmm.
You know, depending upon their age, depending upon the method of injury. So this is where exactly the medical specialty of interventional pain medicine which pairs with primary care physicians, internal medicine doctors, who are the first interception of these non-penetrating injuries, if you will. But to actually understand the difference between somebody who was having a minor injury associated with something that is easily treatable versus somebody who has had a seemingly minor injury, which actually is much more complicated, is the preamble to the earlier question that we discussed, which is seek medical attention right away. That way you can get routed to the proper system, because all of us physicians are trained to anticipate things of what we, I don't want to beleague the point about delayed onset muscle soreness, but sometimes a microfractures can occur due to small and short velocity injuries. So it is important to always go to the doctor and then get properly evaluated.
Very true. And I do emphasize that with my clients all the time, that any small hit can actually result in unexpected injuries.
For you as an attorney, we talked about how does somebody find you? How does somebody find you?
Mm-hmm.
From a medical legal perspective, how do you interact with the various other medical providers? What is important for you when you're seeking to help an injured person?
Well, I always look for credible doctors, doctors who understand traumatic injuries, because not all injuries are the same. You could have someone who has a sore neck and back just from sleeping wrong, or someone who has a sore neck and back from being suffering an impact and suffering whiplash. Those are different injuries, but they could have the same symptoms, right?
But specifically when it comes to, for example, medical writing, a lot of the times, having been involved in multiple explanations, if you will, or so-called depositions, I was very careful in understanding how attorneys are asking questions.
Mm-hmm.
So it is very hard at times to answer some questions which are presented to us. And obviously, as I developed my practice, I understood the importance of correct charting. But what kind of advice could you give to a young physician or even a patient when they're describing their injury? How important it is, for example, to enunciate that a person was wearing a seatbelt or not wearing a seatbelt. By the way, you should always wear a seatbelt when you drive.
Of course.
You should always obey the speed limit. We're talking about injuries that are not preventable here, but there has to be a due diligence and a sense of responsibility of you as a consumer. You're driving a car, you are driving a lethal weapon. You have to make sure that the car is sound and in operating mode, that you abide by all the rules and regulations. If you don't, then I, as a physician, have a duty to help you out no matter what. But an attorney over here will have significantly harder time to claim any kind of an injury in a person who's negligent.
Of course, it's either going to be working for you or working against you, depending on what side of the position you are. But to answer your question, how can doctors notate or maybe extract the information from the patient?
That's the word I was looking for, yeah.
Better to strengthen their case for an attorney like myself to have leverage and to be able to argue their injuries and how it affected their loss of normal life.
When you say argue, you mean advocate for the patient?
Of course.
Right.
The doctor just needs to ask the right questions. In my experience, people are not the same. Depending on the generation, depending on the background and ethnicity, some people do not like to complain. I see with older generations or immigrants, the worst things could happen to them. They could have their arm falling off, and I ask them, how are you feeling? They're, oh, I'm fine. I want to go back to work. I'm like, no, you're not fine. Your bone is sticking out of your arm.
Yeah.
And you need to talk about that. And you need to explain to the doctor that I used to like to do 1, 2, 3. And now because my arm is broken, I can no longer do 1, 2, 3, or I can do it, but the experience now is different.
Yeah, that kind of brings me to the earlier point that we made, that pain perception is different across from different cultures, age groups, and of course people who are very stoic in their appearance.
True.
I have a question that was burning. I think that we talked about the right way to do things and not so much, not a good way to do things. I respect you and I value you because not only did we collaborate in the past, but I know you on a personal basis. So as I was saying, you're a person with great integrity.
Thank you.
You come from a humble background. You come from a big family. So the reason I'm bringing all these accolades to you is not only just to paint you as a good person, but also to paint you as somebody who, as a professional, abides by the rules and regulations.
Of course.
In this world of personal injury, there is a lot of people that are referred to as ambulance chasers. There's a lot of people who do things in an unethical way. And when I asked you, and I wanted you to come and be my guest for our inaugural podcast, it was precisely because of that, because you embody somebody who's not that.
Oh, I appreciate it. Thank you.
You know, I've seen and heard of cases where patients are sometimes being referred by unscrupulous other providers and physicians by busload, and then being taken to these mom and pop shop quasi-medical clinics, which are being staffed by improper medical personnel. How do you look upon that and keep a straight face? And maybe can you shed a little bit light on that?
That's something that it's really disappointing to see because it happens. I'm not gonna sit here and pretend like everything is rainbows and butterflies. Unfortunately, there are some fraudulent cases that happen, and that can kind of ruin it for everyone else. But we do a really, really good job at screening people and asking detailed questions. And the same way that you have your tests to make sure that someone is not malingering or faking their injuries, we have our questions that can also reveal if someone is being truthful or if they're just money hungry, seeking a check. I tell people, I mean, this is not your lottery ticket. This is not, you didn't hit the jackpot.
So you basically cut it off at that point. You essentially do something that, if I understood you correctly, you just refuse clients.
Of course. I mean, we get maybe 20 calls a day, and out of those 20, we'll turn down 15, if not more. Not every case is one viable. Not every case is winnable. And sometimes you have people who are calling you for the wrong intentions.
Right. And that was basically the point that I wanted to bring. You know, the aspect of a physician taking care of a patient, when we were trained, we obviously, everybody has heard of the Hippocratic Oath and about do no harm, do as much good as you possibly can. These are the tenets of all medical professionals. When I trained, we had patients who were prisoners. Who would come, get shackled, unshackled. Surgeons and myself as an anesthesiologist would perform the procedure, and we were impervious to what did they do, or why are they in shackles, for example. So that veracity to the task and then truthfulness to providing the proper care is something that guides me even to this day. I have in my own practice encountered similar things that you have encountered in law firm, where patients come in and they basically make stuff up. And to me, as a professional, as a physician, this is probably one of the most demeaning things that I, as a physician, have to do, which is to essentially tell in so many words to someone that they're lying. So that's why, in my opinion, attorneys like yourself really stand above the rest, because you are not only a gentleman, but somebody who understands the psyche of a person in front of you, so that you provide care in the same manner like myself as a physician.
No, thank you, and of course it's very honorable what you do, and I know Not all doctors are the same. Some of them do just want that quick check, and the same with lawyers. But me personally, I know that sometimes maybe I could just go along with it, but that's not who I am.
Yeah.
I want to be honest and be able to go to sleep at night and say that I'm one of the good ones, and I'm one of those guys who will turn down $1 million case if I feel like it's not really a case. And I just turned down a case the other day where someone told me they were involved in the crash. I looked at the police report. I only saw one name, and I was like, were you really in this car crash? And I had to really dig and tell him, look, just tell me the truth. Were you really in the car? After like 20 minutes of going back and forth and scaring him and telling him this is fraud, you'll get into a lot more trouble than it's worth, finally he tells me, no, I wasn't, but look, let's just go with it, because everyone is going to say I was there.
And that was your cue to say,
I said, sorry,
talk to you later.
yeah, I can't take your case. I got to drop you. And I dropped him.
Shifting just for 1 second, obviously you're familiar with multiple various types of medical professionals, but the intersection in between an attorney who practices personal injury law and someone like myself who practices pain management is sort of like very synonymous and very collaborative. Because this is not really a conversation only about me as a physician. I have great many colleagues who are excellent. And rather than ill speaking about other physicians, I'd like to understand from your perspective, as a general field of pain medicine, what is your impression of it and how do you interact as an attorney towards us as physicians?
Well, specifically for pain management doctors, they are critical for helping people who are in chronic pain. Pain is no joke, especially when it's chronic.
Or acute pain.
Or
Because
acute.
if we're dealing with somebody who's had a car accident 2 days ago,
Usually it's acute, and then it becomes chronic after some time because it doesn't go away, right? Chronic pain is medically termed as anything that lasts longer than, 6 months?
yeah, depending on the classification. But yeah, we have a classification of acute pain, which is 0 to 3 months, subacute, 3 to 6 months, then anything more than 6 months is considered chronic pain.
Yeah, so I have some clients where it's just like they call me and they're crying and they're telling me, Mohammad, my whole life is different now. It's just not the same, and I'm miserable. I had a client who told me, I'm in so much pain, I want to kill myself. And I really had to call, like I went to his house and sat with him, and
Oh, you do house calls too?
of course.
Oh, wow.
And hospital calls too.
Wow.
You just got to be personable and reachable. And I give everyone my cell phone because I want them to think of me as a friend, not just a lawyer.
Sure.
So I had to go to his house and sit with him and talk to him and make sure that he wasn't going to do anything to harm himself. And without doctors like yourself who can do that interventional pain to give that injection or whatever the procedure needs to be.
One of the important things about what I do as a physician in pain management is literally classifying that patient, what we just talked about, acute, subacute, and in chronic pain. And depending upon who is in front of me, then I can either review prior things that were done for that patient or provide, in a lot of instances, nothing more than a supportive ear. But for us in pain management, we look at people who have no obvious physical signs of damage in various different ways. Obviously, whenever somebody comes to the physician, I would hope that they are essentially given as much latitude in terms of proper examination. What I have encountered through hearing stories from other patients is that a lot of physicians, for example, don't check patients for bruises, don't check patients for marks from the seatbelt which was worn, and you will be surprised how many times when patients are properly examined, you find these things that patients did not even know themselves, and that kind of leads into obviously proper evaluation going forward. But a typical pattern and a typical modus operandi of a pain management physician is to work in a collaborative approach with physical therapists, with primary care physicians. I have a great respect for all primary care physicians because at the intersection of all medicine, especially in the United States, is that house which holds the center point of all of us who should be referred to specialists from that area. So a lot of internal medicine physicians, family medicine physicians, sometimes OB physicians, and even pediatricians act as primary care providers. So we then bounce back these patients back to them and seek for their opinion. And then, of course, a lot of the times there is a necessity to provide some sort of a medication that is helpful for the patient. Most people believe that prescribing opioid medications, or at least that's the perception that patients would have, with the first choice. And that's actually not the case. That's not true. The United States is probably one of the only countries in the world, if not the only country in the world, where you can comfortably walk into a physician's office and get an opiate prescription and almost expecting to get an opiate prescription. Try to do that in Europe or anywhere else throughout the world. Opiate prescriptions are only reserved for catastrophically injured patients and in the hospital. So even if a physician who works in an outpatient center like myself wanted to prescribe somebody an opiate prescription, not possible. This does not happen.
Oh.
So the expectation of a person who was injured, for example, outside the United States and United States is completely different. The experience is different.
Yeah. No, I mean, to just jump in and add to your something that you said that stood out to me is that when you're examining a patient, you know what to look for. And that's because of your experience in personal injury. Not every doctor knows to check for bruises or to check for red marks from the seatbelt.
Well,
That's huge.
Well, I'll tell you this, Ben. I think that a lot of doctors know that. I mean, we're taught that in medical school. It's just that there's this tendency to have a laissez-faire type of an approach to a lot of patients, especially if you see something over and over again. And then, in the United States specifically, there is this thing about modesty and about, not offending patients. So because I come from a different background, before I was a physician, I was a physical therapist.
Yeah, true.
One of the very first things that we as therapists have been taught is to actually to touch patients. And I don't mean inappropriate touching, but to look at the firmness of their skin, to touch the temperature. And these are normal parts of the physical examination. And when I transitioned into the world of medicine as a physician, as an interventional pain medicine physician, that kind of it was just second nature to me, Whenever the first time patient comes to my office, they're asked to essentially first and foremost come in comfortable clothing, but also to disrobe. We obviously have, shorts and gowns and things of that nature to, provide modesty. But to me is incomprehensible that I, as a physician, would not ask the patient to take the socks off so I can look at their legs to see if there are any bruises, varicose veins, abnormalities, and then obviously I want to describe those things and put them in a note.
And that is just the difference between a winning case and a losing case. Having those kind of tests done and recorded in the records makes it real. Yeah. Because if it's not done, if it's not recorded, it's not evidence.
Correct.
And then you're leaving your patient or your client hanging. You're leaving money on the table, or you're doing a disservice to your patient,
of course,
who has a pending case.
Yeah, that I agree with you wholeheartedly. Well, I think we touched upon a lot of good points, and I also wanted to say something about yourself, which is wonderful. You not only speak English fluently, but you also a fluent Arabic speaker and a fluent Spanish speaker.
Spanish, I'm working on it.
Okay.
Yeah, I'm half Mexican, half Palestinian.
Of course.
Alhamdulillah, نحكي عربي. Español. Un poco. Mucho gracias.
Okay. But you do have somebody in your office who speaks Spanish, correct?
Yes, I have 5 employees who are fluent in Spanish. I have 3 employees who are fluent in Urdu and Hindi. I have an employee who speaks Turkish. I have 6 employees that speak Arabic, including myself. What else? Yeah, I think those are all.
So it's a multicultural office, and this is actually one of the great points about your particular law firm. Independent from you being a good attorney, it is reachability. In a metropolitan city like Chicago is, being accessible to patient does not mean just having the prime location downtown or the center of everything next to the bus stop. It is actually exactly what you embody. Communication.
Connection.
100%. Yes,
Right?
yes. For a patient who is timid or who doesn't have a good maneuver and verbosity in English language.
Not articulate. You
Exactly.
need to kind of ask them those questions and extract it.
Sure.
Same with you when you're examining someone, right? I ask them,
Absolutely, yes.
does your knee hurt? Does your back hurt? Does your neck? What about your elbow? What about when you sleep? And they're like, oh, yeah, actually, yeah. And
They
this
didn't
is all
think of it.
true.
Right.
I'm like, of course it's true. And he's like, I didn't even know to tell you this. I was like, okay, what about, you have a dog? Yeah. Do you like walking your dog? It's like, yeah, but actually I can't walk him anymore because he tugs. I'm like, there you go.
Yeah.
These are things that you need to be aware of that you're probably not conscious of.
And just like in your office, multilingual aspect of your practice is also something that we have at Loop Medical Center. I also speak Arabic and I speak Spanish language, not as fluent as I would like to, but I'm in a process of learning even more.
You and I both.
And then I speak also Serbian, Croatian, Bosnian languages that are just like you are half Palestinian, half Mexican. I myself half Serbian and half Syrian.
It's very cool.
So I'm proud not only of my heritage, of my dual heritage, but also of an ability to help somebody that comes to my office, fully knowing that I can immerse myself into a conversation with somebody who needs help. And that's the essence of both of our roads and the intersection of how we do.
It's a beautiful thing, connecting with another human being on their level.
Yes. Well, it's been a pleasure having you.
Pleasure's all mine, Doctor. Thank you so much.
My pleasure. And hopefully we'll have plenty of future memories to share and talk about.
Definitely. And I'd love to come back, sometime in the future. We'll have some more stories to share. And
absolutely, yes.
This was a great time. Thank you.
It's a promise.
Looking forward to it.
Thank you for listening to yet another episode of, what is it called, Lucy? Just kidding. Inside the Loop. Inside the Loop or Inside the Loop?
Inside the loop.
Inside the Loop.
Let's do it again.
All right. All right. Thank you for watching yet another episode of Inside the Loop. We really appreciate it and look forward to seeing you again.